Hi, it's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was part 19. My sister is in ICU on a balloon pump and ventilated after cardiac surgery. The ICU doctors want to stop treatment against our wishes and let her die. What should we do? You can check out last week's episode by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to start answering a question from one of my other clients, James, which are excerpts from one-on-one phone and email consulting and advocacy sessions with me. And the topic this week is part 1 of a one-on-one consulting and advocacy session with me. And again, one of my clients, James. And the title this week is What They Don't Tell You in Intensive Care When It Comes to Weaning from Tracheostomy and Ventilation. James and his sister Christine contacted me last year in August, and him and his family were facing a massive challenge. His dad, in his early 70s, had a hemorrhagic stroke, and he therefore had a massive bleed in his brain. When James first contacted me, his dad had already spent a few weeks in ICU and already had a tracheostomy because he needed long-term ventilation in ICU. Furthermore, James's dad wasn't waking up due to the increased seizure medication he was getting as part of his condition, and he was also having frequent seizures to begin with. To make matters worse, besides the stroke, the seizure activity, and the long-term ventilation, the intensive care unit was adamant to send his dad out of ICU into long-term acute care, also known as LTAC. And if you have followed my consulting and advocacy for any length of time, you would know that I strictly advise against long-term acute care or even subacute care. The reason for that is that I simply can't tell you how many people contact us in desperation when they have a loved one in LTAC and want to get them back into ICU. LTACs are a disaster at the best of times. Cutting to the chase, in this series of one-on-one consulting and advocacy sessions with me and my client James and his sister Christine, I can show him and his sister how to keep his dad in ICU against the hospital's wishes, and I can show James and his sister how he can negotiate best care and treatment for his dad, including getting him off the ventilator and the tracheostomy, as well as managing the seizures. Enjoy today's consulting and advocacy session, and most of all, use it to your advantage. Also, keep an eye on the next consulting session that I have with James and his sister. It'll come out in a few days. And if you're watching this on YouTube, click on the link below this video because it'll get you to our website where you can read the consulting and advocacy session and you can read the dialogue there. So enjoy. So, how can you become the best advocate for your critically ill loved one? How can you make informed decisions, get peace of mind, control, power, and influence quickly once your loved one is critically ill in intensive care? You will get to that all-important feeling of making informed decisions, get peace of mind, control, power, and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you will learn quickly how to make informed decisions, get peace of mind, real power, and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you will learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider, that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions. Discover the many competing interests in intensive care and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power, and influence in your situation. You will get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You will get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Also, have a look at our membership site intensivecaresupport.org for families of critically ill patients in intensive care. Or you can call me. Find international phone numbers on the top of the website. Also, have a look at our ebook section, and you can also get one-on-one consulting and advocacy with me via Skype, over the phone, or via email by clicking on the tabs on the top of the website. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.